switch speakers, and we have great friend from Jordan, Dr. Mamoun Elbashir, who will dealing with healing ulcer more than revascularization. Mamoun.
Thank you very much. Apologies, Osama, for taking your slot. This is a totally different base and a different topic. It's healing the ulcer more than revascularization, getting the ARC. Sorry. So this topic is in regards to the wound care burden, and this is a massive area of cost effectiveness and intervention for vascular surgeons and other specialties. The downfall of a lot of vascular surgery procedures when it comes to limb salvage is not actually the procedure itself, the revascularization, be it interventional or surgical. It's what follows that. It's the wound and it's the complications and the problems you get to the stage where the patient is completely healed and off the care. He doesn't need the care anymore. And the wound care burden worldwide is massive. In fact, wounds, when you classify them as a pathological process and a disease, a healthcare risk, they're really pretty dangerous stuff to have. They're more dangerous than having, colon cancer or any lung cancer. It's terrible. If you look at the relative 5-year mortality rate, it comes down there in the middle of all these horrendous 5-year survival cancers. In addition, it's a marker of mortality. So having an amputation, be it a minor amputation or a major amputation, is a major marker of death. So 66% higher risk of death when you have one of these amputations. The etiologies for leg ulcers are a multitude, and most of them are vascular, venous being the prime risk factor for an ulcer because that's the most common. The big three are venous, arterial, and neuropathic. That's why all the move now is, especially in the States, is for limb salvage centers. So we're not talking about interventions or vascular surgery in small units, but rather specialized centers that focus on revascularization in addition to what follows, because your final aim is to get to complete healing for your patient. This is our center in Amman, and this is the multitude of services that we provide, but it's a limb salvage center more than being a vascular center. Wound products these days are massive. This is one of the smaller companies in wound care, B. Brown, and you can see the multitude of products they have. So to sort yourself out amongst this myriad of products, you need to have the sort of attendance and knowledge of all the means available to get wounds to be healed. And that's why we developed our own system of wound healing that we apply in all our cases and called the ARC, equivalent to the Noah's Ark, where you get rescued from disaster, and it's composed of 4 components: ARCC, A being for assessment, and we use all available possible ways to assess, including the history, the duplex, and investigations for infections. R stands for revascularization, and that's the step I'm going to skip, and we're not going to focus on it, but it's an essential step because essentially a lot of these pathologies are an ischemia pathology, be it at the major or the minor level. Followed by that, we go for cleaning, and that's not just physical cleaning, but also pathological, where we get cultures for infections and we treat them accordingly, because we know that a lot of these problems arise because of the biofilm and the infection on the surface of the wound and deeper tissue. C for coverage, and this is the important point, because once you get a wound revascularized, you get it cleaned, you have to cover it somehow, and I'm a great believer of covering all wounds as soon as feasible, be it skin grafts, skin substitutes, or back therapies, and all means possible available for the interventionist to get to that. And to be honest, I have great interest in this topic, and that's why we scour the world looking for newer and advances in coverage of wounds, including skin substitutes, which are very popular in the States. They happen to be extremely expensive, and we were finding that the more we get into this field, the more advances there is. These are some examples of our cases where we do our own skin grafts. So as soon as we've done the revascularization, we've done the cleaning, we cover the wounds. Skin grafts are the commonest way, but we have other methods of doing it as well. This is the future, and this is we've just started with this, and we're sort of getting to be the center for it in the region pretty soon. So it's the 3D tissue printing. This is an example of 3D printer for organs, and it's coming over the next 10 to 20 years. With skin, it's much easier, and it's already in practice. So this is the machine, and it's a quite simple process where you get to have components for the skin graft that you can put in tubes and 3D print from directly to the patient. And this combines artificial intelligence with advances in forming skin substitutes. So there is a scanner, a special laser scanner that scans the wound and gives you exact shape and size of the wound, and you choose the depth of coverage that you want to cover for. And once you've done that, then you have a blueprint of what the wound should be. At this stage, you take some fat cells from the abdominal wall that are taken by a syringe. These are put through a simple centrifuge, which is 3 tubes, consecutive tubes, which extracts the basic cellular material from these fat tissue. And this is put into 3 different tubes that you add to them components that are already prepared, pre-prepared. Includes fibrin. These come in a sterile bags. Each patient have his own kit that is going to be used exactly for this patient. The combination of all will eventually print a skin graft which is exactly to the shape and size and depth of that wound you wanted. I'm very excited about this project, and I think it's the future for a lot of coverage of all these wounds. In addition, we use other means to advance that, and this is part of our center as well, including hyperbaric oxygen therapy, ozone therapy, all the other adjuvant therapy that we go through. So I'll finish there, and thank you very much.